Welcome back, Studio 701.
You may have heard of Botox as a way to help with wrinkles. We're not all as naturally beautiful as Jeff here.
We're not.
And age lines, but did you know it's administered for therapeutic purposes as well? That's pretty interesting.
Dr. Kristen Shook, a dentist with Polish Dental, joins us now.
Hi, thank you for having me back.
Good morning, Kristen.
Thanks for being here, Kristen.
Yep.
So I imagine a lot of clients, don't go to the dentist with the intention of learning about Botox, but you tend to treat some ailments that might actually benefit from that. So what kinds of problems do you treat patients for?
So a lot of patients over the years come in with a lot of jaw pain, TMJ, the temporal mandibular joint, jaw pain, oral facial pain, headache type complaints, and for a long time, we've tried a lot of different things, and it's just like we were missing something, a way to treat them to help relieve this pain. So hearing about the Botox as being a possible option, we did all the training, looked into it, and dentists are already very trained with the anatomy of the head and neck and doing injections all day long. Botox seemed like kind of the next step for us as a mode of treatment for these patients. 25% of people suffer with oral facial pain, TMJ, headache type symptoms. 90% of those patients that we often see in our office are women. So going through the training to come up with a way to help them was just wonderful for us.
If you're watching this right now and you think, I kind of get headaches or I kind of have jaw pain, what should you do as far as finding out if this treatment might be right for you?
Yeah, so the first thing is to call our office and set up a consultation. So we do a very thorough head and neck exam, examine the joint itself. A lot of times if we're examining the joint and you have really good mobility and motion of the joint, a lot of times we can determine that it's actually muscle related. The muscles of the face are used for opening and closing the jaw, speaking. They can get very tight. A lot of people are clenchers and grinders. They clench their teeth all night long. They get these really tight, spasmy muscles in their face. So what we essentially do is we locate that area of the hardest, tightest, hot, spasmy muscle and inject the Botox therapy right into that spot. It takes 7 to 10 days for that therapy to start to take effect, but once it starts to take effect, patients get relief for up to 3 months oftentimes.
Jeff, what was your reaction seeing that video? I was just thinking, would you be able to handle that, Jeff?
I might be able to handle, because it's a small needle, right?
Yes,
yeah.
Very, very tiny needle. Compared to our dental anesthetic syringes, I mean, it's super tiny. Patients oftentimes who are struggling with this pain almost get some relief when we get into that trigger point of that hot part of the muscle. It kind of feels good for them, for us to get in there. We are very conservative with our dosing, so it's oftentimes we're just following the pain. We're finding those spots. The masseter muscle in the jaw is a very common one. The temporalis muscle up here, both of those muscles work together for opening and closing and chewing. So we're finding those hot spots. We can push on those muscles and patients will say, ow, yep, ow, that's where it hurts. So then we know that's exactly where we're going with that Botox therapy. One potential side effect of doing Botox for oral facial pain is that we know that there is an aesthetic outcome with Botox therapy and relaxing the muscles. So anytime we do it in the frontalis muscle of the forehead, we are very trained in the aesthetic outcome. So we know exactly what we're doing to put it into the proper places, but that aesthetic outcome is essentially relaxing the and relieving the wrinkle lines of the forehead. So 99.99% of the time, patients are happy with that as a side effect to their Botox
therapy. So you're
therapy.
saying they not only get a medical treatment, but also some aesthetic.
Yes, there's an aesthetic benefit that goes with it, for sure. I mean, they're happy about that. Mostly, they're happy to have 3 months of relief from the chronic pain that they're struggling with.
And is there a time where you just say, we can't do it to you, or is there a time when it no longer works, or?
We actually find that the more treatments you do, we can actually give you long-term results, maybe to the point where you don't need to do it as much or as often. A lot of times we start with every 3 months. If they're having a lot of issues, we'll set up their 3-month appointment, see them back in 3 months, but we may in the future be able to do it every 6 months or once a year or only when they're having issues, just because we're essentially retraining those muscles to be more relaxed and not so on fire.
It's fascinating.
It really is.
Thank you, Kristen, so much.
Thank you for having me.
All right, and for more information, make sure you check out polish-dental.net. Call Kristen, make an appointment. And coming up next, what do you most like about winter, Jeff?
Well, the director of tourism is here to talk with us about that and lots